Healthy Habits
on Afternoons with Helen Farmer.
Talking women's health this afternoon, it is Endometriosis Week. This is a condition that affects almost 176 million women worldwide. However, many do not know they have it. Joining us now is Dr.Ibtisam Ali Masood, joining us, obstetrician gynecologist from Dr. Suleiman Al Habib Hospital, to take my questions and yours. And indeed, if you've got any questions that you want to get in touch with anonymously, that's absolutely fine. Doctor, really appreciate your time. And I don't want to say happy Endometriosis Awareness Week, but I feel like it is, these awareness weeks can be incredibly useful for educating people about conditions they might be living with, and as I said, not even knowing about. So if it's all right with you, and I know this is very common parlance for you, but many of us still somewhat in the dark, are you able to explain exactly what endometriosis is?
Hello, this is Dr. Ibtisam Masood, consultant obstetric gynecologist, Canadian graduate. Yes, as you said, endometriosis is very common, and some people, they might not know that they have it already. Endometriosis is the traveling of the lining of the cavity and implanting somewhere else than the endometrial cavity, like inside the abdominal cavity, in the pelvic cavity, on the ovaries, and in the on the bowel, and during the period they will start having severe pain, and these cells will be implanting, invading the tissue and the organ inside them and causing severe pain, infertility, impacting really their quality of life.
So it's a condition, so it's cells from the lining of the uterus ending up spreading to parts of the body where it shouldn't be. And as you're talking about, the pelvic area, but even in rare cases, places like the lungs, even the brain, and the result, as you're saying, that is extreme pain. Now, I know a number of people have had endometriosis and continue to struggle with it, but a big part of the frustration was how long it took to get a diagnosis. Do you know why that might be? What are some of the reasons that you've heard in the industry, Doctor?
Usually the delay of the patient that's presenting to the doctor is the reason. And some of them, they use it to very painful menstruation and consider it normal for them. And so that's because usually they think that painful menstruation is really normal and one of the natural part of their natural process.
It's so sad. I would say that painful periods are unfortunately common, but they are not normal. There are doctors such as yourself who can help, whether that's with pain management or, in the case of endometriosis, getting to the root of that cause. So in terms of signs and symptoms that women need to look out for, can you give us a little rundown of some of the red flags, so to speak?
So the endometriosis, it affects all the women in the reproductive age, starting from menarche, from the onset of the period until menopause. So the girls in the school age, if they start having severe pain during their period, like unusual pain that's sometimes not even controlled by the regular analgesic medication, presenting to emergency with pain, so that's not normal. So they have to seek attention and to go to the doctor and talk about it.
Well, there's also kind of symptoms that might not seem related to gynecological health. So things like depression, anxiety, bloating, even fatigue. Are those some of the questions you'd be asking in clinic?
Yeah, because of the recurrent pain, they will have some anxiety, some panic attacks, still because they will be waiting for their period because of the pain is really bad. They start having all the psychological symptoms. Some of them, they might have nausea, vomiting, severe diarrhea, back pain, and some of the patients that are married and still trying to get pregnant, delaying the pregnancy also is one of the reasons on the infertility. One of the causes, one of the endometriosis can affect the fertility as well.
So this condition does affect fertility?
Yeah, it's definitely one of the major reasons for infertility is the endometriosis, because when it is implanting inside the ovary, It will distract the ovarian tissue and the follicle and decreases the ovarian reserve, and that will delay the pregnancy and also affect the tubes. So because of the adhesion, the implantation, they will have tubal factor and ovarian factor infertility.
Now, I wanted to ask you, a lot of women do get painful periods every month, but tell us about the testing that you might do in order to reach a diagnosis. To reach the diagnosis, the first, endometriosis has 4 stages. First stage and second stage, we will diagnose them usually by history first. If they have the severe pain, presenting, missing work, missing school, despite regular periods. So that's one of the clues for endometriosis. And also we can diagnose it with ultrasound or MRI. Sometimes if we don't see anything with endometriosis, with the MRI or ultrasound, and we still have very, very suggestive history, then laparoscopic diagnosis will be the gold standard with the tissue diagnosis and pathology. We've got a number of messages we're going to try and get to. Before we go to the text line, I wanted to ask then, once you have reached that diagnosis, what is the treatment plan? What would you tend to suggest to, let's say, a young woman in her 20s, 30s, who might be seeking to get pregnant at some point? What can treatment look like, doctor?
So the treatment will be depending on the stage of the endometriosis. If it is first or second stage, medical treatment would be an option for her. If it is third stage, fourth stage, starting having ovarian cyst, endometrioma, doing some tests to check their tubes, and if it is blocked, then the laparoscopic surgery would be the answer for her to remove that endometrioma and try to release all the adhesions to open her tubes so she can get pregnant.
Going to the text line, Sarah saying, I was wondering what kind of hormonal treatment is recommended for endometriosis after a pregnancy. So managing the condition after having children, any insights there?
Yes, the medical treatment also one of the good options if the fertility is not sought at this time. So then birth control will be an option. Progesterone only tablet is an option as well. Injections, Depo-Provera injection, Mirena IUD will be also one of the options, especially if they have heavy bleeding. And also Fizan. This is a medication specifically for endometriosis. It targets the endometrial spots and it dissolves it. And it's really effective in the treatment.
Doctor, thank you so much for your time. I really, really do appreciate it. For anyone that's just tuned in, are you able to tell us just very quickly some of the big signs that a painful period might need further investigation by a doctor such as yourself?
Okay, if the pain is really, really severe and it's not controlled with the regular analgesic medication like Benadryl or Profen or Voltaren, then this is not normal and you need to seek a medical treatment and medical help. And also taking lots of medications, pain medication in a day, more than 3 or 4 tablets a day, so that's not normal as well. So you really need to see your doctor.
Well, Doctor, thank you for your time. Really do appreciate it. Dr. Ibtisam Ali Masood joining us, consultant obstetrician gynaecologist from Dr. Suleiman Al Habib Hospital, marking Endometriosis Awareness Month. If you want her details, drop me a little message on 4001 saying doctor, and I will